Welcome to Innovators, a series where we sit down with thought leaders in the healthcare technology space to talk about news and trends impacting the industry today. My name is Justine Giancola. I'm on the corporate communications team here at Inovalon, and joining me today is Jonathan Boldt, our very own CFO. John, always great to sit down and chat with you. Thanks so much for taking the time to be here today.
Great, Justine. I'm very excited to be here.
So, John, tell us a little bit about yourself and your role at Inovalon.
My name is Jonathan Boldt. I'm proudly married to my high school sweetheart, and we both live in Florida. I've been at Inovalon for almost 13 years now and have been serving as our CFO since 2018.
And as a leader in the healthcare technology space, tell us this. What is your number one leadership rule?
My number one leadership rule is to provide a very open and transparent communication so that everyone feels comfortable voicing their opinions. And I am very much a believer that bad news should travel faster than good news.
Well, as an employee at Inovalon, I can say I think you do a great job at both of those things. So, having been at Inovalon for just a few years now, tell us, what has it been like to see us grow over that time, but also how has the healthcare landscape kind of changed and grown as well?
Over my 13 years, you've continued to see the U.S. spend almost 17% of our GDP on healthcare. And the largest driving factor continues to be increasing costs of pharmaceuticals, an increasing aging population, and then also a lower supply of qualified healthcare individuals providing that care to members. And one of Inovalon's driving forces has always been is how can data and technology really focus to improve healthcare and economics. And over the last 13 years, I've seen us grow to serving almost 20,000 customers and really trying to focus how that data, how each individual's data can be provided to a healthcare provider at the point of care so that the best outcome can be delivered for that patient, as well as at a reduced cost to avoid overdiagnoses, reduced labs, and other unnecessary costs that sometimes go with just normal healthcare.
So it kind of leads me into our next question. Over the years, we've recently went from a publicly traded company, we're now privately held. How has the CFO role evolved with that transition?
That's a great question. I've said over the time period when we were public, a lot of my time was spent with investor relations, as well as making sure that the normal reporting regulatory compliance with the SEC was occurring. And since we've gone private, what I've been able to spend more of that time or more of my time doing is really working with our product teams and our technology teams so that we can continue to accelerate our product development and impact on the healthcare market, which has been incredibly exciting. So learning how our machine learning and AI capabilities and our large proprietary data set can improve patient outcomes and health economics. And that's really what has been exciting since going private.
And that goes back to outcomes and really kind of changing healthcare. So we're able to focus more on that end goal and mission. So Inovalon is continuing to grow and evolve. What would you say that professionals in the finance industry kind of should be watching? Why should they be watching Inovalon?
Primarily based on our data and our AI capabilities. Everyone's seeing AI is not a fad. It's here to stay for the next decade. And the winners within the AI space will not only be individuals with the large proprietary data sets to train your models on, but also to continue that ongoing refresh of data and the connectivity. And really, as Inovalon has been founded as data-centric, data first, we continue to not only focus on having the largest curated data set, but also how can we make it even better? How can we deliver better outcomes? How can we accelerate our product development so that we can reduce the cost of healthcare within the U.S. and increase the access of appropriate care?
That's great. And, John, again, as an employee at Inovalon, seeing all of the great work that we're doing, seeing us kind of work toward that goal of being a leader in the healthcare industry has been very rewarding. Great working with leaders like you. Thank you so much for taking the time to sit down, have this conversation with me today. For those of you who have dialed in, thank you so much for watching. And as always, stay tuned for our next session of Innovators. Thanks so much, John.
Thank you, Justine.